So my name is Cheryl, I am a community midwife and I work in Whitley Bay. So postnatal visits, we generally do 3 visits, but that can change depending on yourself, as we provide all women with individualised care. Generally, we come out the day after you've come out of hospital with your baby, when your baby is 5 days old, and day 10 is the final visit and we hand over to health visitor care. On the primary visit, we will make sure your physical health is all right, so we'll ask you lots of little questions about your breasts, your perineum, your legs, all sorts of things, and make sure that you're feeling okay and everything's within the normal realm. We will also ask about your birth experience. It's really important sometimes that you talk about how your birth went, and sometimes we can sort of iron out a few things. Sometimes you'll think, I'm not sure what happened and when. We can have a little look at your notes and discuss that with you. We will also have a little look at your baby and make sure baby's feeding okay, whichever way they are feeding, and we can make sure that your baby's looking happy and healthy. On day 5, we will do all of those things again, and what we also do is do the newborn blood spot with your consent, which is a little prick on the baby's heel, and it tests for 9 conditions, mostly metabolic conditions, blood conditions, and also cystic fibrosis. The results take about 6 to 8 weeks for that to come back, and if there's any problems, you will get a phone call. It's just a little prick. You'll have heard lots of horror stories, but normally babies are absolutely fine and most of them sleep through it. We will also weigh your baby on day 5 to make sure that the feeding's going okay and that they're thriving. We will sort of troubleshoot any problems that may be happening, and depending on the weight loss, normally babies do lose a little bit. Depending on the weight loss, we'll make a plan if we need to with regards to your baby's feeding. On day 10, we do all of those things again. We always look out for your physical and emotional health and that of your babies. And if everything's okay, if everything is within the realms of normal, we hand you over to health visitor, and we'll give the health visitor a call and just tell them if there's anything that they need to take note of before coming out to visit you between day 10 and day 14. So, although your physical health is really very important, we also assess your emotional well-being. After having a baby, hormones can surge, and quite often you may feel a little bit tearful and you're not sure why, or you can feel a little bit sad. This depends on each woman. Every woman's completely different, and this is normal to feel this way initially. However, if there are things that you think, I don't feel right, I feel really anxious, I feel really depressed, I'm unhappy, I don't want to take my baby out, or just anything at all that's different to the norm from how you would normally feel, speak to your community midwife. We have many services available in the trust to be able to help you with that, so don't ever suffer with it. You could also speak to your GP. I know some people have really good relationships with their GP and they could always talk to their GP about it. There's loads and loads of help out there, so never suffer with it. Always speak to your community midwife. It's really very important, and as important as your physical health. The 3 visits are as standard. However, we do provide individualised care and we can titrate that care to your needs. So some ladies who are struggling with feeding or anything that's abnormal, you will have your community midwife's number. Give her a call and she can always add in additional visits whenever you need. So although we normally hand over care to the health visitor on day 10, you are actually under a midwifery remit until 28 days. So even if you have been discharged, you can always contact the unit you delivered at to speak to a midwife until the baby's 28 days old, and they will help you. If you need the community midwife team to come back out, they can always do that too. Sometimes you may not be discharged on day 10 if we're concerned, or if you don't want to be at that point.